Hello everyone. Today we are going to start with a new topic, and that is renal failure. Whenever we talk about renal failure, it has to do with your kidneys. So your kidney, it makes up around 5% of your total body weight. Though it is small, your kidney receives around 22% of your total cardiac output. So you can see that your renal perfusion is very high. Now, your blood flowing into your kidneys, they get filtered, right? So filtration will help in your removal of your nitrogenous waste, removal of your excess fluid present in your body, remove or maintenance of your electrolyte, as well as your acid base balance. So this is, you can say, these are your basic functioning of your kidneys. So we'll come and we'll talk about your acute renal failure first. So what is acute renal failure? Acute renal failure is generally characterized by abrupt reduction in kidney functioning. So this your term acute is there because for your acute renal failure to develop, it does not need a very long duration of time. Your onset of time for development of acute renal failure is very short, and it generally develops within 48 hours of period. And with your development of acute renal failure, there is impairment in your kidney functioning. So whenever there is impairment in your kidney functioning, it will lead to accumulation of nitrogenous waste products as well as other toxins as well. Okay, so classification of your acute renal failure and your causes as well. So your acute renal failure can be classified into three different types. First one, your pre-renal, and pre-renal is accounts for around 40 to 80% for all your acute renal failures. The major cause for your pre-renal acute kidney injury or pre-renal acute renal failure is because of decreased renal perfusion, which means that there is reduced blood supply to your kidney. So because there is reduced blood supply, it will lead to pre-renal kidney failure. Second is intrarenal. When we talk about intrarenal, 10 to 50% of your cases of your acute renal failure is because of intrarenal causes, and generally in this there is damage to your renal parenchymal cell. Your cells in your kidneys are getting damaged. Okay. Thirdly, there is post-renal, that is after your kidneys, and generally less than 10% of your cases for your acute renal failure is because of your post-renal causes, and your main cause for your post-renal acute renal failure is because of urinary tract obstruction. So there are three different types: pre-renal, intrarenal, and post-renal. So pre-renal, okay, so this is a general diagram of your urinary system, your entire urinary system. When we talk about pre-renal causes, there is decrease in your perfusion to your kidney, and generally this decrease is because of your blood entering into your kidneys. So all your changes is happening before your kidney starts. There is generally less amount of blood being supplied. Second one is intrarenal. Whenever we talk about intrarenal, it has to do with your kidney itself. There is damage to your parenchymal cells within your kidney. Okay, so in this case, your parenchymal cells of your kidney are getting damaged, due to which you get your intrarenal kidney injury or kidney impairment. And lastly is your post-renal. All your structures that come after your kidney, in case of post-renal, that is your ureter, there may be blockage in your ureter, which will cause post-renal. There may be blockage in your bladder, again post-renal because it comes after your kidney. And then there may be blockage in your urethra. So or any blockage occurring to your structures in your urinary system after your kidney will cause post-renal kidney failure. Okay, so we'll go one by one through all these things, all these topics. So first we come to your pre-renal. In case of pre-renal, the main cause for pre-renal injury or pre-renal excuse me, pre-renal injury is because of your impaired perfusion of your kidneys. When we say there is impaired perfusion, it means that your blood supply to your kidney has declined. Okay, and this impairment of your perfusion to your kidney is basically because of your decrease in your blood volume, that is hypovolemia, which means decrease in your volume of your extracellular fluids, as well as decrease in your intravascular pressure, that is decrease in your blood pressure. Okay, intravascular volumes, hypovolemia, intravascular, a decrease in your blood volume or your volume of your fluid, as well as intravascular pressure, decrease in your blood pressure, can lead to pre-renal injury or pre-renal failure. So pathogenesis of your pre-renal failure, first one is because of your decline in your extracellular volumes. Okay, coming to your pre-renal injury pathogenesis. So effective extracellular volume, there's decrease in your effective extracellular volume, and this decrease in your volume may either occur because of hypovolemia, cardiac output, decrease in your cardiac output, or systemic dilatation. So first we'll talk about your hypovolemia. Now in case of hypovolemia, which means decrease in your level of your fluid, so whenever there is decrease in your level of your fluid, okay, of your body, it will lead to decrease in your amount of volume of your blood as well. So this decrease in your blood volume will cause decrease in your blood pressure. Also there is decrease in your blood flow. So both your decrease in your blood pressure as well as decrease in your blood flow will lead to decrease perfusion of blood in your kidneys. Okay, so your kidneys are, your blood supply to your kidney is going to get hampered because of decreased blood volume, which will lead to decreased blood pressure as well as decreased blood flow. So generally your kidney is going to receive less amount of blood. Second is cardiac output. When we talk about cardiac output, okay, now there is decrease in your cardiac output. So whenever there is decrease in your cardiac output, means there will be decrease in your blood pressure, right? Lesser amount of blood coming out of your heart means blood pressure is going to get decreased. So along with that, there is going to be less flow of blood as well. So again, these two factors is going to affect your renal perfusion. So there is going to be less amount of blood entering into your kidney. And lastly, there is your systemic dilatation. Now in this case, your cardiac output or your blood volume does not change, so your blood volume remains same. The only change that occurs is, in this case, see, if this was your normal blood vessel, in case of systemic dilatation, your blood vessels throughout your body is going to dilate. Okay, this was a normal blood vessel, but after systemic dilatation, your size of your blood vessel is going to increase. Since your size of your blood vessels is going to increase, these blood vessels are going to accumulate more amount of blood. So if there is more amount of blood getting accumulated in different parts of your body, your amount of blood going into your kidney is going to decrease. So this also leads to your pre-renal failures. Now your causes, okay, let's see your causes for each one. In case of hypovolemia, excessive sweating may cause hypovolemia, right? If you sweat more, you are going to lose more amount of water content from your body. If you lose more amount of water content from your body, your blood volume is also going to decline. Diarrhea and vomiting, the same thing. Inappropriate diuretic use. Diuretics, these are your drugs which will increase your urination. So if you urinate more, more amount of blood is going to more amount of water loss is going to take place. So if more amount of water is getting lost, your blood volume is definitely going to decrease. In case of diabetes, so whenever you are using osmotic diuresis, so that time also, yeah, excreting more amount of fluid. Hemorrhage, you bleed more. If you are bleeding more, your blood volume is going to decrease. And in case of burns as well, your blood volume is going to decrease, due to which you are going to have hypovolemia. Second is cardiac output. If you have acute myocardial infarction, it will lead to decreased cardiac output because your contractility decreases. Cardiac failure, same thing. Hypotension and intraoperative, intra or pre-operative cases as well, there will be decreased amount of cardiac output. Lastly, there is systemic dilatation. Whenever there is septicemia occurring, or anaphylaxis, which is just severe allergic reaction, which is called dilatation of your blood vessel, also that time can lead to renal acute failure. And lastly, pharmacological vasodilation. Whenever you are using your drugs, okay, drugs which are going to cause dilatation of your blood vessels, that time also it will lead to systemic dilatation, by which you are going to get less perfusion to your kidneys. Next one is your pre-renal failure by altered renal vascular regulation. In this case, let us see one thing. Okay, firstly, your blood flow into your kidney is totally, or into your nephron, is totally controlled by your afferent arteriole bringing your blood in, and your efferent arteriole taking your blood out. Okay, there are two major arterioles, afferent arterioles and efferent arterioles. And under normal conditions, if you see, your afferent arterioles diameter is always large, it is big, your diameter is bigger than your efferent arterioles. Okay, see here, even if when you see your diagram over here, you can clearly see your afferent arterioles, they are wider, and whereas efferent arterioles, they are smaller. Now the main reason for this is, whenever this helps in generation of development of pressure in your glomerulus. So this development in your pressure in your glomerulus helps in your filtration of your blood. So in case of altered renal vascular regulation under condition of hypercalcemia, sepsis, or in case of you are taking drugs, okay, what it may cause is, it may cause afferent arteriolar constriction, that is, which means there will be constriction in your afferent arteriole, this arteriole which was supposed to be wider or broader, so there will be dilatation, so your diameter is going to decrease. So this decrease in your diameter of your afferent arteriole is going to decrease your pressure within your glomerulus, thereby it is going to affect your normal blood flow to your kidney as well. Secondly is, basically, if you consider your drug NSAIDs, they are going to block your prostaglandins. Prostaglandins, they are generally responsible for dilating your afferent arterioles. So if you block this generation of prostaglandins, you are going to block your dilatation of your afferent arteriole, due to which there is going to be decrease in your glomerular, the pressure of your glomerulus, which decreases your filtration GFR. Second is efferent arteriolar dilatation. Okay, one of your main function of your angiotensin 2. Okay, your angiotensin 2, what they generally do is, they go and they cause your constriction of your efferent arterioles. Angiotensin 2, they cause constriction of your efferent arterioles. So if they are getting constricted, your pressure remains optimum. So if you are taking any drug which is going to block your generation of your angiotensin 2, then there will be dilatation of your efferent arterioles. So your pressure over here is going to change, your GFR is going to get affected, with effect in your diameter of your efferent and your efferent arterioles. Next is your intrarenal. When we talk about intrarenal, in case of intrarenal, your intrarenal failure generally occurs because of your damage occurring to your parenchymal cells in your kidney itself. So your intrinsic or your intrarenal failure results from conditions that causes injury to your structures within your kidney. So any damage to your structures within your kidney will lead to intrarenal or intrinsic renal failure. So the major causes for your intrinsic failure is ischemia associated with pre-renal failure. Okay, if there's ischemia in any of your arteries bringing in blood to your kidney, then perfusion to your kidney is going to be less. If perfusion is less, then there will be damage to your kidney. Why? Because it is not receiving blood. So if it is not receiving blood, then damage is meant to happen to your kidney. So okay, so major causes because of your ischemia associated with pre-renal failure, as well as injury to your tubular structures of your nephron and your intratubular obstruction. Even when the obstruction is there, then also it can lead to intrarenal failure. So now your major structures which can get damaged in case of your intrarenal injuries are, it may either be because of your damage to your vasculature, damage to your glomerulus, damage to your tubules, or damage to your intestinium. So first we'll talk about your vasculature. Your vasculature within your kidneys may get damaged because of your directly but through your trauma. Okay, any trauma or physical injury occurring directly to your kidney will damage your blood vessels within your structures of your kidney. So it can lead to intrarenal failures. Second is in case of your glomerulus. In case of glomerulus, if anyone is suffering from glomerular nephritis, okay, if he or she is suffering from glomerular nephritis, which generally occurs because of immune response in the glomerulus in response to your infection occurring in your kidney. Okay, even if there is glomerular nephritis, that can also lead to your intrarenal acute failures. Third is your tubules. Your damage to your tubules, major cause is because of acute tubular necrosis. Okay, a main cause for your damage to your tubules is because of acute tubular necrosis, and this acute tubular necrosis generally occurs due to your ischemia occurring. Okay, you have your main cause for your generation or development of your acute tubular necrosis is because of ischemia. Now your blood flow to your kidney has reduced. Your structures of your kidney, your tubules is not getting enough amount of blood. So if it is not getting enough amount of blood, there will be reduction in your oxygen. So because of this reduction in your oxygen, your tubular cells will undergo necrosis, and 80% of your intrarenal injury is because of your acute tubular necrosis. 80% of your intrarenal cause injury is because of your acute tubular necrosis. And lastly, we have your interstitium. So interstitium damage can occur because of acute interstitial nephritis. Interstitial acute interstitial nephritis, and this acute interstitial nephritis generally occurs in your body because of your type 1 hypersensitivity reaction. Okay, acute interstitial nephritis generally occurs because of your type 1 hypersensitivity reaction in response to your drugs. Because of your drugs entering into your interstitial space, you get your acute interstitial nephritis. Drugs such as your antibiotics and your analgesics, they cause hypersensitivity reaction in your kidneys, by which it leads to acute interstitial nephritis. Now this will also lead to your intrarenal acute failures. Lastly, you have your post-renal. In case of post-renal, we already told you, pre-renal is any changes to your blood flow before your kidneys. Intrarenal, because of your damage occurring into your kidney, your parenchymal cells of your kidney. And lastly, you have your post-renal. And whenever we talk about post-renal, it is basically due to your obstruction in your flow of your urine. Now, your obstruction into your flow of your urine can occur at different places. It may occur at ureter, it may occur at bladder, or it may occur at your urethra. Okay. Now, in all these three structures, your obstruction can occur because of your any tumor. Any tumor occurring in any of these three structures can lead to blockage of your flow of your urine. If there is blockage, again, then it will lead to your formation of acute renal failure. Apart from this, even your stones, your kidney stones, can lead to blockage in case of ureter and your bladder. If there is a stone in your ureter, that can also cause obstruction. In your bladder also it can cause obstruction. Whereas prostate hyperplasia in your ureter can lead to obstruction as well. So three structures: ureter, bladder, and urethra. In this case, any tumors occurring at any of these three structures, tumors can lead to obstruction. Stones in ureter or bladder can lead to obstruction. Prostate hyperplasia will lead to obstructions in your urethra. So this is what your post-renal failures, or how your post-renal failures occur. Okay. Now next we have your Rifle criteria for acute kidney failure. So what does this Rifle criteria say? Okay, or according to this Rifle criteria, what are the criteria for your acute renal failure? So first and foremost, okay, under what conditions can you say that your kidney is at risk for development of your acute failure? So if there is increased creatinine level. Okay, if your body plasma, okay, plasma creatinine level increases by 1.5 times. Generally, creatinine is excreted from your body only through urine. It is only through urine that your creatinine is getting excreted. So whenever there is any damage to your kidney occurring or any functioning of your kidney is getting hampered, then your blood serum level of creatinine can act as a marker. So if there is increase in your creatinine by 1.5 times to that of your normal, or if there is a decrease in your GRF by more than 25%, then you are under your risk for development of acute renal failure. Or if there is decrease in your urine output by is if your urine output is less than 0.5 ml per kg per hour in 6 hours, then you have a high tendency to undergo acute renal failure. Second is, when does your injury to your kidney occur? So in case of injury, whenever there is increase in your creatinine level by 2 times, your creatinine in your body has increased by 2 folds. Okay, or there is decrease in your glomerular filtration by more than 50%. That means there is injury taking place in your kidneys. Or when you talk about your urine output, you can see if there is decrease in your urine output, or which is less than 0.5 ml per kg per hour for 12 hours, then you are under injury state. Thirdly, failure. When do you say that your kidney is under failure? Okay, under failure, you can see if there is your creatinine level has increased by 3 folds. If your creatinine level in your serum blood has increased by 3 folds, or your GFR has decreased by more than 70%, then your kidney is said to be under failure. And lastly, when you take into account your urine production, if your urine output has decreased to less than 0.3 ml per kg per hour for 24 hours, then your kidney has undergone failure. In case of loss, if there is acute renal failure lasts for a long duration of time, okay, then there is going to be loss of your renal functioning. So this normally occurs, this loss occurs for more, if there is persistent acute renal failure for more than 4 weeks, then there is going to be loss in your renal functioning taking place. And lastly, you have your end stage renal disease. Your end stage renal disease is when your loss of your kidney functioning reaches an advanced state. Okay, end stage renal disease is a state in which your loss of your kidney functioning has reached an advanced state, and your kidney can no longer do its normal work. Your functioning can no longer able to do its normal work. And whenever a person reaches this end state renal disease, he or she has to undergo dialysis. Okay, again, one for risk, there is first you are at risk, then injury takes place, then your failure. If your failure persists for a longer duration of time till 4 weeks, then there will be more loss of functioning, and this continuing for a very long duration of time, more loss of functioning will lead to end stage renal disease. In case of end stage renal disease, your kidney is not able to do its normal functioning. Since it is not able to do normal functioning, normally a patient under end stage renal disease has to undergo dialysis. Next we come to your chronic renal failure. Whenever we talk about chronic renal failure, the term chronic itself means that your onset is not going to be abrupt. So it is going to take time for chronic renal failure to develop. So let us see what chronic renal failure is. So chronic renal failure is progressive loss of renal functioning. So progressive loss meaning it is going to take time. It is not abrupt in nature. So onset of time in case of your chronic renal failure is long, and it is generally associated with systemic diseases. So systemic diseases such as hypertension, diabetes mellitus, or with any intrinsic kidney diseases can lead to chronic renal failure wherever these diseases persist for a longer duration of time. So in case of your chronic renal failure, your glomerular filtration rate is less than 60 ml per minute or per 1.73 meter square for 3 months or more. So generally for your chronic renal failure to develop, it must be persistent for 3 months. Your glomerular filtration rate has to decrease for around 3 months. So only after 3 months you suffer from your chronic renal failure. So let's talk about your pathophysiology of your chronic renal failure. So first and foremost, we have already told the basic major causes may be because of systemic diseases, hypertension, diabetes mellitus. So whenever we talk about your chronic renal failure, there has been two theories postulated: intact nephron hypothesis. This is your intact nephron hypothesis. Okay. Whenever a person is under kidney damage, okay, or there is kidney injury taking place, there is going to be loss of nephron. Okay, any damage to your kidney is going to cause loss of nephron. So whenever your kidney damage progresses, there's going to be more loss of nephrons as well. So whenever there is loss of nephrons occurring, you have surviving nephrons as well. One part is dying off, whereas you have nephrons which are alive as well. So these surviving nephrons, what they do is your surviving nephrons, in order to maintain your normal functioning of your kidney, what they do, they undergo compensatory hypertrophy and hyper functioning. Okay, you have your kidney, a set amount of nephrons in your kidney. Now because your kidney has been damaged, what is happening is you are losing your nephrons. Now your surviving nephrons, what they do is they undergo compensatory hypertrophy, that is they are going to increase the size, as well as there is going to be compensatory hyper functioning. So they are going to do more function than others. The work that they perform, they increase their capability to do more work as well, so that they sustain your normal kidney functioning. Okay, so by increasing your size and increasing your activity, what they do is they sustain your normal kidney functionings, such as your rate of filtration is sustained, reabsorption is sustained, as well as your secretion is sustained. But as this functioning keeps on going, there's compensatory hypertrophy and your compensatory hypertrophy and your compensatory hyperactivity or hyperfunctioning. As time moves on, this compensatory function will lead to glomerulosclerosis. Glomerulosclerosis, and finally you get your end stage renal failure. Okay, this glomerulosclerosis occurs because you are increasing your workload of your nephrons. So you are increasing your workload of your nephrons, they are bound to get damaged. So because of increased workload more than normal, they get damaged in the end. So they form your glomerulosclerosis, and then finally you have your end stage renal failure. This is known as your trade off hypothesis. So if you are trading your nephrons, your normal nephrons, for increasing your hyperactivity and increasing your size of your nephrons, with that there is a risk of glomerulosclerosis. So trade-off hypothesis occurs. So according for that increase, you are going to get your glomerulosclerosis. So that is trading off happening. So let us look at your diagram. No matter what uh, no matter what disease is causing your renal failure, there is always association of your it has always been seen that there is association of angiotensin 2 taking place in case of your formation of your chronic renal failure. So there is always angiotensin 2 has been seen to play a major role in formation of your chronic renal failure. So if you see your table over here, okay, first and foremost there is renal injury. So whenever there is renal injury, okay, I think whenever I do this, your renal injury is going to go off. So this is your renal injury. Okay, your renal injury. Whenever there is renal injury taking place, there is going to be loss of nephrons, right? So if there is going to be loss of nephrons, less amount of blood coming into your nephrons, so it will activate your angiotensin system. Apart from that, okay, when angiotensin tensin 2 getting activated, right, activation of angiotensin 2 will cause constriction of your efferent arterioles. This is the afferent, this is your efferent, blood bringing in, blood going out from your glomerulus. So whenever there is constriction of efferent arterioles, your pressure is going to increase. So there is pressure in your glomerular capillary. So there is glomerular capillary hypertension. Even if there is loss of nephrons, there are other nephrons present in your kidneys, so they will be receiving the more amount of blood. So there is going to be increase in your capillary hypertension in that case as well. So whenever there is increase in your pressure of your glomerulus, it will lead to increased glomerular permeability and filtration. More the pressure being generated in your glomerulus over here, more will be the filtration. since filtration is taking place more in more amount, along with that your proteins present in your blood, okay, proteins are there, these proteins are going to escape and they are going to accumulate in your interstitial space. Okay, so these proteins are going to escape and they are going to uh, get accumulated in your interstitial space. Along with that, more amount of filtration will cause more amount of protein entering into your tubules as well. Okay, I'll repeat it once again. You have increased permeability in your glomerulus as well as increased filtration. So this is your glomerulus, okay, your blood. There's increased filtration taking place. So increased filtration means along with your blood, your proteins are going to escape as well. So there is going to be increased proteins, right? So increased proteins means there's going to be increased tubular reabsorption. Okay, so increase in your tubular reabsorption is going to occur. So whenever increased amount of absorption is taking place, your protein is also going to get accumulated in your interstitial space. That is, okay, you have absorptions from your tubule, so in this interstitial space between two cells, cell epithelial lining of your increased protein in your urine, correct, will lead to increased reabsorption. So since it is getting reabsorbed, there is going to be accumulation of your proteins in your interstitial space as well. Okay, so interstitial space is your space between two cells. So there is going to be increased accumulation of proteins in this area. So this accumulation of your proteins within your interstitial space will lead to tubulointerstitial inflammation and fibrosis. Okay, along with that, angiotensin 2 can directly lead to interstitial inflammation and fibrosis as well. So whenever inflammation and fibrosis takes place, you have your renal scarring. Renal scarring is there. Along with that, you have your systemic hypertension occurring. Systemic hypertension again will lead to activated capillary hypertension. So this is your pathogenesis of your chronic renal failure. What are your clinical manifestations of your chronic renal failure? So let's see your So let's see your clinical manifestation of your chronic renal failure. In case of chronic renal failure, since there is increased amount of angiotensin, and since there is your reduction in the flow of your urine taking place, there is always going to be hypertension. So this hypertension is going to cause heart failure. So along with hypertension occurring, right, there is increased vascular volumes as well, because your reabsorption because of your renin-angiotensin system is taking place at more amount, because of which there is going to be your increased vascular volume is going to increase. So whenever there is increased vascular volume, there is going to be loss of blood from your blood vessels, which can lead to edema as well. So if there is increased vascular volume, more amount of blood is going to flow into your heart as well. If more amount of blood flows into your heart, your preload is going to increase, as well as increased vascular volume will increase your afterload, which will lead to heart failure as well. Second is potassium balance. Whenever we talk about potassium balance, 90% of your potassium from your body is excreted through your kidney. So in your early stage of your renal failure, what generally happens is your kidney is not excreting your potassium normally, but your intestine, they excrete your potassium ions. 90% is excreted from your kidney. So in the beginning of your renal failure, what generally happens is, in order to make up your balance, your intestine, they excrete your potassium. But when your damage to your kidney increases severely, the compensation being done by your intestine is not maintained. Under that condition, you do not lose your potassium from your body. So there is increased amount of potassium in your body, and you have your hyperkalemia. And this hyperkalemia can cause arrhythmias in your heart. Okay, so elimination of nitrogenous waste. In case of elimination of nitrogenous waste, okay, one of your major nitrogenous waste is urea. So there is going to be accumulation of urea. Okay, there is going to be accumulation of urea, or urea, which is known as a azotemia. Okay. Okay. In case of elimination of nitrogenous waste, now your kidney is not functioning properly, so filtration process is not going on properly, right? So urea is going to stay back in your body. Okay, your nitrogenous waste is going to stay back in your body. So there is going to be increased serum urea as well as other nitrogenous compound, and that is known as your azotemia. And this, because of this, you are going to get uremia in your body. Uremia, and whenever uremia occurs, because of uremia occurring, you see different things happening to your body. First and foremost, uremia, when it is at normal conditions, uremia can cause nausea and vomiting. Okay, it can cause nausea and vomiting, as well as loss of appetite, which comes under your gastrointestinal manifestation. But more increase in your uric level of your body, or urea level, or so serum urea level in your body, will lead to neurological manifestations as well. And in case of neurological manifestations, it is known as, the manifestation is S36. Okay, it will lead to S6. Okay, which is generally you get your tremors in your hand, and furthermore increase in your level of your serum urea will cause coma and death as well. Okay, so there is going to be coma and death as well. Along with that, accumulation of urea will cause pericarditis. Okay, your increase urea, this in case of skin disorder, what happens is, this increased urea level goes and gets deposited in your skin, due to which you get your skin disorders. Along with that, you get your sexual dysfunctioning as well as impaired immune functioning as well. uh, Increased urea in your body, what it does is it decreases your ability of your platelets to stick with each other, so it hampers your process of coagulation, so you have your increased bleeding as well. The increased urea decreases the ability of your platelets to stick with each other, due to which your process of coagulation gets hampered, so there is bleeding as well. Kidney is responsible for producing erythropoietin. In case of chronic diseases, you are losing your ability of your kidney to produce erythropoietin, due to which you get anemia as well. In case of acid base balance, normally your H plus ions is being eliminated out from your body through urine, and in this case, since there is decreased elimination of your hydrogen ions as well, there is going to be acidosis occurring. Okay, so your entire buffer system of your body is hampered, again due to which you get your skeletal buffering occurs. Next is activation of vitamin D. Kidney is responsible for activation of vitamin D. The main function of vitamin D, activated vitamin D, is to absorb your calcium. Kidney is responsible for what? Kidney is responsible for activation of vitamin D. So whenever and this vitamin D is responsible for absorption of your calcium. Correct? Now, whenever your calcium is not going to get absorbed, it means you are getting hypocalcemia. Less amount of calcium in your body is hypocalcemia. So this condition of hypocalcemia, what it leads to is it will cause there is no activation of vitamin D, so there is going to be no absorption of calcium. So if the absorption of calcium is not going to take place, in that case, your body does not have enough enough calcium in your body, and because of less amount of calcium in your body, it is your production of your hypocalcemia, and because of hypocalcemia occurring, your body, it tends to release parathyroid hormone PTH in order to maintain your level of your calcium in your body. Okay, so release of your PTH causes your bones to lose calcium. Okay, even your they lose your bones to lose calcium. So PTH, thyroid hormone, parathyroid hormone. So your less amount of calcium is causing your thyroid to work more, because of which you have your parathyroidism as hyperparathyroidism as well, to produce your PTH. So PTH causes your bones to lose calcium, which leads to osteodystrophies. This is known as your osteodystrophy. And I think with this we complete your another topic, which is your acute and chronic renal failure.